to have me in. That's a pleasure for me and honor to be back home. And thank you, Dr. Adil, for giving me this very simple, easy talk and small message. So, stiff shoulder in rotator cuff tear, that's my disclosure, nothing relative to the talk itself. I'll start my presentation with a case scenario. That's one of my patients. He's a 51 years old male, right-hand dominant. He's working as a senior accountant in multinational company. He's diabetic patient under control. He has a pain and limitation in the range of motion for the last couple of months, and it's keep progressing by time and interfering with his daily and sports activity. That's how it looks here, his cuff tear. It's a full thickness cuff tear, if you can see. And if you look carefully at the MRI, you will find some fibrosis in the inferior capsule at that area and on the rotator interval. So from the MRI, we can expect his range of motion. If you look at his forward elevation, it's not going beyond 80 degrees of forward elevation from front and from the side view. And if you look at his external rotation, it's a bit limited, going to 20 to 30 degree of external rotation, and his abduction is significantly limited as well. And here it comes the question usually. His stiff shoulder, most probably secondary to the rotator cuff tear. And the question is always, what would you do in this case? Send him back to physiotherapy, treat the stiff shoulder first, do manipulation or giving steroid or do whatever before going to the cuff repair, or you will do it in one stage at the capsular release and rotator cuff tear. And I will reflect this question, to be honest with you, and let's show our hands. So who's going with the first option? Who's doing in his practice the first option? Okay, quite a few. And the second option? Okay, so that's an easy job. So let's start, let's go. This is my agenda. I will try to answer these two questions. Is this patient with a stiff shoulder plus rotator cuff tear, they do inferior or they do the same like patient with rotator cuff tear in non-stiff shoulder? The second question is, should we go for the one-stage or two-stage procedure for that patient? Starting with the definition, that's mostly for our colleague, the difference between stiff shoulder and frozen shoulder or adhesive capsulitis. Adhesive capsulitis is an idiopathic restriction to the active and passive range of motion. Compared to the stiff shoulder, it's a broad definition. It's including the idiopathic and including as well the secondary stiff shoulder, which might be due to rotator cuff tear like our patient scenario. The stiff shoulder in cuff tear, why it did happen? There is some explanation for that, like the pain of the cuff tear itself might limit the patient range of motion, ended up with a stiffness. The muscle weakness itself might end up with a stiff shoulder, and the contracture of the joint capsule itself might end up also with a stiff shoulder. And as we mentioned before, the option of treatment is one of two. There is no other option of treatment for that patient. Why people and why some of senior colleagues, and this is the classic teaching before, they don't touch and they don't repair a cuff before getting a full passive range of motion, which make a lot of sense. The rotator cuff repair surgery itself, it's a shoulder tightening procedure. And this patient, a patient you need to mobilize him as soon as possible to avoid further stiffness and make a lot of sense. But the problem with this technique of getting a full range of motion first, you are prolonging the patient's suffering time because he is in pain and he has a limitation and this is affecting his life. The rotator cuff tear itself, if you may extend this conservative treatment for 6 months, you never know what is going to happen in this 6 months. Maybe the tear itself might increase in size, more retraction, more scar tissue of the tendon itself, fatty infiltration or wasting of the muscles. That's the drawback of the two techniques for treatment of this patient. Again, back to the agenda, the first question which I'm trying, let's go to the literature and see how this patient, stiff shoulder plus rotator cuff tear, compared to the patient with rotator cuff tear in a non-stiff shoulder. That's a 25 patient of stiff rotator cuff tear compared to another group of rotator cuff tear alone. And if you look at the 2 years follow-up, they almost do the same, except the non-stiff group have better internal rotation compared to the patient who have a stiff shoulder with a cuff tear. That's another one, the same article. Look at another point, which is the re-tear rate, comparing the two types of patient. And guess what? The patient who had a stiff shoulder, they do have very low re-tear rate compared to the patient who doesn't have a stiff shoulder with their rotator cuff tear. And this may be explained by this type of patient. They are a bit stiff. They might produce more scar tissue. That's why their re-tear rate is very, very low compared to the patient who have a rotator cuff tear with no stiff shoulder. Another article comparing the same two types of patient with a rotator cuff tear in a stiff shoulder and non-stiff shoulder. And the stiff group also have better re-tear rate compared to the non-stiff group. Another article comparing the same type of patient, 47 patient in the stiff group and 22 patient in a non-stiff group. And statistically, there is no difference in the range of motion, the strength, the pain score, or the functional outcome. So it seems that in conclusion, this stiff patient with a rotator cuff tear, they do exactly like the patient who have a rotator cuff tear in a non-stiff shoulder, assuming that you do a good capsular release at the same time of the surgery. And this is a systematic review just recently published as well, comparing a large group of patients. And you will find that the final follow-up, they exactly do the same in terms of range of motion and functional outcome, and even the re-rupture tear is almost the same. Let's move on to the direct point, comparing the two protocol of treatment, which is delaying the surgery until the patient have a good full range of motion, or you do them in a one stage doing a capsular release plus rotator cuff tear, rotator cuff repair. There is two articles published on this direct comparative study between both of them. They actually do have a small sample size, but this is the available in the literature. 22 patients underwent one stage procedure, capsular release plus rotator cuff repair at the same setting, compared to 20 patients they sent for physiotherapy, range of motion, and later on for rotator cuff repair. And that's the outcome. 3 months post protocol or post surgery, they almost do the same, except that the patient with the physiotherapy before surgery and the two stage, they do a bit better in range of motion. But look at the final follow-up at 6 months, 12, 24, and the end of the follow-up, they do exactly the same. So the guys who did physiotherapy and rehabilitation before their surgery, they show some improvement in the early outcome, 3 months, but later on, from starting 6th month to the end of the outcome, they do exactly the same. And there is no significant difference, not only in the range of motion, but also in the pain score and the functional outcome. But this 20 patients who underwent conservative treatment for the recovery, guess what? 6 patients of them, which is around 30%, they refused to continue with the conservative treatment, meaning that they choose not to keep suffering from the pain, and they asked to stop the conservative treatment and to go immediately for the surgery. And this is a very important point when you take a decision in your patient. You have to pick up which patient can tolerate the conservative treatment for a long time and which patient cannot tolerate this pain and limitation and functional disability till finishing his physiotherapy. The second comparative study, which is also comparing the two groups of patients, group 1, underwent the rotator cuff repair plus capsular release one stage, as we said. Group 2, 36 patients underwent 6 months of rehabilitation, then rotator cuff repair 2 stage. The follow-up was around 2 years. 2 patients of group 2, as we mentioned before, they said, no, we cannot tolerate this conservative treatment and we need to fix our shoulder. But the interesting point that 4 of this patient, they did very well in the range of motion and they managed their stiffness and they didn't want to go for rotator cuff repair. That's another point as well, which could be an advantages of the conservative treatment. But finally, look at this number, 14 of this patient who's ended like 30 patient in group 2, 14, it's almost 50% at the time of surgery. After 6 months of conservative treatment, they still have a stiff shoulder and they still need a capsular release with a rotator cuff repair. That's the 2 published articles comparing the 2 types of treatment, and it seems from the outcome of both of them that it is in favor of doing 1 stage in most of the patients compared to the 2-stage protocol. The retear rate was exactly the same. There is no big difference. And if you look at the case series, there is a lot of case series published in the literature. One of them is coming from Buddy Savoy, and they came with 1 stage. They do very well, and they highly recommend the patient to go for 1 stage rather than going for an extensive time of conservative treatment before going to the capsular release and rotator cuff repair. Back to my patient scenario, if you remember the patient and limitation of range of motion, and I've been convinced with this type of patient since he's working in a job where he cannot tolerate the pain for a long time and he's not able to manage his pain. That's why I choose to go for 1 stage capsular release, and it's the formal capsular release as we do, taking down the rotator interval, then going down to the anterior capsule and going to the inferior part. And I'm usually selective in my posterior capsular release according to the patient range of motion. Does he have any internal rotation deficit or not? Because some of the patients, they don't have problem with their internal rotation. And then the formal cuff repair. And usually this type of patient, they do have small to medium-sized cuff repair. They don't have usually extensive or massive rotator cuff tear. So the formal cuff repair, it's up to your technique. It doesn't make any difference, single row, double row, whatever you used to do. So this patient is a small cuff tear. For me, I usually go with the speed fix technique, mattress stitches and lateral knotless anchor, and they do very well. And I usually do with them some sort of subacromion decompression, trying to improve the biology for healing of this patient. And that's the post-operative rehabilitation for them. They have an arm sling and they're doing passive range of motion from first week and active range of motion after 6 weeks. And that's his outcome 4 months post-surgery. He is fine with forward elevation and abduction. He's okay with his internal and external rotation as well. And he's happy with that. And he went back soon to his job, which is very important in this type of patients. So my take-home message, this patient with a rotator cuff tear and stiff shoulder, if you do a capsular release with a rotator cuff repair, they do the same exactly like the patient who have only rotator cuff tear. 1 stage versus 2 stage, you have to judge your patient. You have to see how it is affecting his life, how it is affecting his daily activity and his acceptance for the 1 or 2 stages. And this finally, I'd like to invite all of you for our Dubai Shoulder course in October. Thank you so much.